Okay, so we're going to go ahead and get started. Let me share my screen. I'm going to introduce our awesome members. So we have Dr. Cynthia Harper here with us. Dr. Harper is a professor of obstetrics, gynecology, and reproductive sciences at the University of California, San Francisco School of Medicine. She's on the steering committee of the UCSF Bigsby Center for Global Reproductive Health and is the director of the UCSF Kaiser Birch Scholar Training Program, building interdisciplinary research careers in women's health. She also runs a national contraceptive training program for healthcare providers and health educators beyond the pill. She conducts research to help to improve access to contraceptive care, particularly among young people. Welcome, Dr. Harper. We also have Dr. Jennifer Yarger. She's a research scientist at the Bigsby Center for Global Reproductive Health at the University of California, San Francisco. Her research focuses on reproductive health disparities and evaluation of reproductive health programs. She directs the UCSF College Health Study, which is testing an intervention to increase contraceptive awareness and access among community college students. So we are so thankful to have you here presenting from California, and I'm going to let you take it away, Dr. Harper.
Thank you so much, Shannon. We're so happy to be here this morning. We have worked for many years together with TCI and are just really impressed with all the work that all of your groups are doing in Oklahoma. Our main goal this morning really should be to bring some of our warmer airstream to you so that your heat stays on. But we are here to share with you, hot off the press, our new findings from data we have collected on youth access to contraception during COVID-19. These are preliminary findings, and so we welcome any feedback from you or any thoughts. We're still digging deeply into this. Next slide, please. Okay, we are at the Beyond the Pill program, as Shannon said, at the Bigsby Center for Global Reproductive Health, and we are active in various components of contraceptive care. Our team conducts research, which is what we're going to be talking about today. We also do training with health departments and community clinics across the country in contraceptive counseling, and we train on the full range of methods and have specialized training for IUDs and implants for people who need that, and we have youth education programs. Next. So one of our core beliefs underlying all of our work is that access to contraception is central to reproductive autonomy, including for young people. And the framework we use for this research is the socio-ecological model that really pays close attention to contextual factors in the social determinants of health and how reproductive health of a young person is situated within those larger contextual factors. And young people face structural barriers to contraception, including lack of insurance coverage or affordability in a lot of cases, discrimination in medical institutions, and a host of other barriers that we'll be talking about in our talk. There are concerns that the COVID-19 pandemic has created even additional barriers and widened inequities in contraceptive access. Next. So we have a series of research questions that we're really pouring through the data with a full, they're a big team of us. And the primary one is how the pandemic has affected young people's access to contraception. And as I said, we're looking at the impact of the pandemic and how it varies by the social determinants of health. Another area that has caught our attention are life disruptions, economic hardships caused by the pandemic, how these are associated with access to contraception. And a very important phenomena that has arisen during COVID is telemedicine. So we're looking closely at whether young people are using telemedicine to access contraception during COVID. Next. The study, the data that we've just been collecting is a study that we're conducting among community colleges with community college students age 18 to 25, right there at the end of adolescence, beginning of young adulthood. And we're conducting our study in California and Texas. We have great partners at the University of Texas, Austin. And we have sites throughout the state. And a lot of sites you'll see concentrated in those COVID hotspots in Southern California. And then in Texas, we have the Rio Grande Valley and other spots in actually throughout Texas. They've been really affected by the pandemic. The participants in our study are students assigned female at birth who are sexually active. And we began our study and still have as an important component community engagement that we call Student Voices, where we involve students at each of the sites and hold interviews with them and ask them, what do they think about research? What do they think about research on their campus? What about sexuality? What about education on health topics? What do they think in particular about our study? And we really listen closely to the interviews, and they help us to figure out how to interface in each campus site, what it's like, basically how to work with the communities in each place, which can really be different from each other. And we're so grateful to the students. We also interview key informants on the campuses, like in the Student Health Center and faculty. So we are testing in this large study a multi-level intervention on both the health system side and the individual student side. Our training program is working with health clinics surrounding each community college. We building a network, a stronger referral network for all of the community clinics surrounding the college. And we bring them our training in contraceptive care and in person-centered counseling to help to equip them to serve young people in particular. And now during COVID have been focusing on the things that they can do in their clinic to deliver safe in-person care with the scarce resources that they have, staff and limited PPE, and also how to shift care to telemedicine when that's possible, but to be alert to the pitfalls with telemedicine and the people who are going to need to come to the clinic. Then on the student level, our intervention gives education to students and gives them digital resources that they can use whenever they want, interactive resources to find out where care is in their community, find out the hours and the truncated schedules during COVID, what methods they can get there, what kind of coverage there is and affordability, and also whether there's telemedicine and things like that that help them to access care. So we added a special component to measure the impact of COVID-19 on the health and well-being of young people for this study. Next slide, please. And our sample is, as you can see, the ages, they're primarily right there at the end of adolescence, 18 to 19 years old, and then some in their 20s. We have a diverse sample. We have a large Latinx population because of the sites in the community college student makeup where we are active. You can see with the Speak English at Home, where half do and half don't, that we have a lot of people, a lot of immigrants. And we also have in this a lot of first generation college students, about a third. And our study, we're looking at economic hardship, but we're also looking at people who face a lot of challenges and educational disadvantage, who are trying hard to get higher education. And basically our role is to support them in the reproductive health care they need while they are while they're in school. Next. So our first research question: how has COVID-19 affected young people's access to contraception? Next. Not surprisingly, the students reported a high level of barriers to healthcare during the pandemic. I think this is probably true of all age groups, and particularly young people. Half of them stated that COVID-19 had made it harder to get the needed healthcare. One student, age 19 in California, said, "It's been harder to go to the doctor if I need things or need an appointment, just because I'm not sure how safe it is, and I don't want to risk it." Another 19-year-old said, "Since I'm not able to go to the doctor, I've not been able to get treated for my increased anxiety and depression." And you'll see throughout this talk that the data, we really did notice in the data that a lot of these mental health indicators that are important to pay attention to among young people right now. Next. So we found that nearly a quarter of the students reported that the pandemic had affected contraceptive access and made it harder for them to get birth control. Those are the blue in this pie. Next. And we asked them how COVID-19 has limited contraceptive access to see the particular impacts. And 26% wanted a method but couldn't get it. 22% wanted to switch methods but couldn't. And switching methods is super common among young people, and it's just an important part of contraceptive care, as many of you know, just to always be at the ready when somebody wants a different method, when one didn't work out for them. 19% wanted to get an IUD or an implant but couldn't get it. A lot of the clinics were having troubles providing care. The young people were having trouble getting to clinics. And 14% couldn't get their IUD or implant removed when they wanted to. Next. So these slides show what the students said, how they couldn't, how it was harder to get access to birth control. And most of them said the biggest reason was there's just too much going on. I think that the pandemic has been overwhelming, and all the changes in people's lives, as Jem will tell us later about these life disruptions, were really primary. The rest of the reasons were basically access reasons. There were just a lot of access reasons. I can't get an appointment, almost 40%. Clinic is closed. I can't travel to the clinic. Transportation was also one. I can't afford it, 20%. Next. These also are reasons that they've made it harder, and again, they're access reasons. I can't visit the clinic during their hours. I don't know where I can get birth control. Then the doctor isn't available, or telehealth isn't, and the clinic doesn't have my method. Those were very few who said that, but a few did. Next. So these are quotes from a couple students who explaining the challenges while they're living at home and during COVID, sheltering in place to get birth control. One person, age 18 in California, said, "My insurance is tied to my parents still, and I don't know if consulting birth control services will increase the costs or not. I might have to let them know at that point, and I'm not very comfortable with it. I'm waiting for COVID to pass to go to the doctors." And this other student, also 18, said, "My parents don't know I'm sexually active. They ask what places I'm going to when going out." Yeah, next. So how has the impact of COVID-19 varied by the social determinants of health? We know that COVID-19 itself has been heavily concentrated in people who are already facing a lot of challenges with higher cases among Latinx population, much higher death rate among Black Americans, and with other groups also experiencing particular challenges. So we looked at these social determinants of health to see what was happening in our study. Next. Community college students are disproportionately low income, a lot of immigrants in school, as well as first generation students. So this student, age 20, said, "I struggled financially, especially being a dreamer, left my family and I out of government aid, and we're surviving as much as we can." Another 20-year-old from California said, "My parents are working and are at high risk of getting COVID. We don't have enough money, we're low income, and we have little resources, and COVID makes it hard and stressful." Next. So we did see in our data that students with economic hardship were more likely to report COVID-related challenges accessing contraception. In total, 23% said that it was harder to get birth control, and among the uninsured, that increased to 26%. Among those who reported food insecurity, 27%, and also 27% among those with housing insecurity. Next. So we looked at racial and ethnic differences and the pandemic's impact on access to birth control. And interestingly, we did not see the inequities that exist in a larger society with structures. We actually saw that the Asian students in the study were far more likely to report that COVID made it harder for them to get a birth control method. We are going to be examining this more closely. We also have measures of experiences of discrimination, just life experience, and also with the healthcare system. So we're going to be looking at those measures to see if we see reflected racial ethnic inequities or if something else is going on in our particular study population. Next. When we looked at food insecurity, however, we did see the same inequities that exist in our larger society, with the Black students reporting a much higher proportion with food insecurity. We also saw this with our measures of housing insecurity. Next. Okay, now I am going to hand this over to Jen, who is going to talk about life disruptions and a little bit more about those mental health indicators that the students mentioned in their quotes. Jen?
Okay, great. Yeah, our next research question is going to be looking at how these life disruptions that are caused by the pandemic are associated with young people's difficulty accessing contraception. And we'll go to the next slide. We asked participants about their direct personal experience with COVID. And as Cynthia mentioned earlier, a number of our study sites are located in COVID hotspots. Among this group of young people, 15% had experienced COVID symptoms, 14% had cared for someone who was sick with COVID, and 1 in 10 reported a death in their family due to the virus. Next slide. In the open-ended responses, participants talked about their physical and psychological challenges as they or their family members had become sick or passed away due to COVID. One 20-year-old in California said, "I think I have COVID. I was sick for a few days and I didn't have energy to do my online classes. It made me very stressed." Another 18-year-old in Texas said, "Getting COVID affected my entire family, and my younger sister still suffers the effects to this day." A third participant from California shared, "My grandma passed away because she had COVID. She was 60. It affected me so much. In many ways, I didn't think it would. I lack motivation to do anything now, and my anxiety has been at its worst." Next slide. This sense of anxiety and stress was actually really widespread among this population. 63% of our participants said that they felt stressed due to COVID, and overall, 87% reported feeling stress. Nearly half reported feeling depression or anxiety due to COVID, and 77% overall felt depressed or anxiety. When we asked about the impacts of the pandemic, one participant who was age 19 in Texas shared, "It has made me depressed to the extent of losing about 50 pounds. Another 19-year-old in Texas wrote, It has caused me to get antidepressant medication. I have so much anxiety and feel more depressed. I feel like a failure all the time and just have lost all hope and motivation. I can't even be myself anymore, not even as a mom. It's really affecting my mental health in so many ways. Next. We also heard about the educational challenges that young people are facing. With many of the colleges closed, students have had to adapt to online learning, but we know that not all students have access to the internet or a computer at home or a quiet place for them to log into their classes. Among our participants, more than a quarter stopped taking classes due to COVID, and 69% said that the pandemic had made it harder for them to achieve their educational goals. Next slide. The pandemic has also impacted many young adults' economic security. 44% have family members who lost a job, and more than a third lost a job themselves. With this loss of income, nearly a third reported worrying about paying for food or housing due to the pandemic, and 13% said they moved to a new apartment or house due to COVID. Next. So as we've just seen, the pandemic has caused so much instability in young people's lives, and instability or life disruptions can make it really challenging to try to make or carry out plans, including those plans to take care of your health. So we found that life disruptions caused by the pandemic were also associated with difficulty accessing contraception. As shown in the top bar here, 42% of those who were caring for a sick family member said that COVID has made it harder to get birth control. In the next bar, 41% of those who lost childcare said COVID made it harder to get birth control. And these findings were similar for the other life disruptions that we studied. So if young people had moved, experienced a death in their family, or worried about paying for food or housing because of the pandemic, they were also more likely to report that COVID has made it harder to get contraception. Next slide. And similarly, we found that young people who reported feeling stress or depression due to COVID were also more likely to have difficulty accessing birth control. And so stepping back, when we're thinking about ways to try to improve access for young people during this pandemic, it's important to keep in mind the ways, the amount of change, uncertainty, and mental health challenges that they are facing. Next slide. Okay, at this time, we're going to take a break from sharing some of our data, and we would love to hear from all of you. We're interested in hearing from your work with young people. What have you observed? How has the pandemic been affecting access to contraception with the young people in your community? And we would really invite you to share your observations, your insights in the chat box. We're hoping to get a little mini chat conversation going here to give you a chance to share your experiences. And if we were in person, I would have like a candy bar or something to throw out to try to give a little extra motivation. Yes, Suzanne, thank you for sharing. We agree. It's hard to read some of these quotes out loud and not want to not break up, because they really shared how difficult the pandemic has been in their personal lives. What are you guys seeing in your work with young people? Does anyone feel comfortable sharing any other observations? We will also have some other opportunity in the presentation. Yeah, Laura shared, with the disruption to post-secondary spaces and people being in disparate places, it's hard to connect older adolescents to sexual health services. Definitely, some of the younger school levels have returned in person, but I think a lot of the colleges are still remote, and that definitely makes it harder. Okay, I think we're gonna, for the sake of time, we're gonna move forward in the presentation and we'll go ahead to the next slide. Thank you for sharing. Okay, our next research question and our last one today is looking at how young people are using telemedicine to access contraception during this pandemic. Next slide. Telemedicine has expanded really rapidly during the pandemic, but we don't have a lot of data on young people's use of telemedicine to get birth control. In our sample, 81% were using a birth control method, and among those, 39% received their method at a clinic. In California, we have a state law that allows you to get birth control directly from a pharmacy. In Texas, you still need a prescription. In our sample, around a quarter went straight to a pharmacy to get their method. Just 7% received their method through a telemedicine appointment, and 4% had a method mailed or delivered to their home. Another 4% said that they ordered it online through a website such as Amazon, Nurx, or GoodRx. Just a small number, just 2%, received their method through a curbside or drive-through clinic. So we're seeing that the most common way to get contraception is still through clinics, although young people are also choosing these other ways to access a method. Next slide. Even though only 7% had used telemedicine, most young people reported that they would be able to have a phone or a video appointment to get birth control. Just 1/4 said that it would be difficult to have a telemedicine visit for birth control. And as you can see on this chart here, slightly more participants indicated that it would be difficult to have a video visit than a phone visit, 20% compared to 14%. And next. The young people in our study reported a number of barriers to participating in a telemedicine visit for birth control. Most said that they would prefer an in-person visit. 3/4 said that they have to get their method in person, or they didn't know if their method was available through telemedicine. 3/4 also said that their clinic doesn't offer telemedicine appointments, or they didn't know if their clinic offered telemedicine. 61% said that their health insurance wouldn't cover a telemedicine appointment, or they didn't know if it would cover it. 43% said that they lack a private space for a telemedicine appointment. And 38% said that they just wouldn't feel comfortable with a telemedicine appointment. Another barrier is that over 1/4 said they didn't know how to do a telemedicine appointment. And then finally, over 1/4 said they didn't have the phone, the device, or an internet connection needed for a telemedicine appointment. Given that young people live so much of their lives online, I think it's easy to assume that they would have easy access to telemedicine. But we're seeing in our data that there are a number of challenges that will need to be addressed to make sure that there's broader access to telemedicine in this population. And we'll go to the next. It's also important to recognize that people's attitudes about telemedicine are nuanced and really dependent on their personal preferences and their circumstances. One 18-year-old from California said, "I don't want to put me and my family at risk when we can stay home for now." Another participant in California shared, "I'm suffering from chronic yeast infections over the last 12 months, and the doctors will only accept phone visits. I'm not getting the care I need, and it's affecting my mental, physical, and sexual health." Next. Another finding that jumped out in our data is the need for youth-friendly information about telemedicine. So 62% said that they didn't know if their doctor offered telemedicine appointments. Half didn't know if their insurance would cover telemedicine. Over 1/4 didn't know if they actually needed to go in person for their method. And we recognize that many young people don't have a lot of experience navigating the healthcare system, even outside of a pandemic. So there are a lot of opportunities here to expand young people's health and digital health literacy. Next. We also found that access to telemedicine for birth control is not equal across all young people. For example, in this chart, we are seeing that 23% of participants who never have difficulty paying for food reported that they would have difficulty with a telemedicine visit, compared to 30% who sometimes do and 32% who often do. Next. Despite all these barriers to telemedicine, it does look like there's interest in methods that don't require a clinic visit. For example, here we're looking at subcutaneous depot, or sub-Q depot, which is a new formulation that can be self-administered. A quarter of our participants had heard of sub-Q depot. And then after hearing a description of the method, 23% said that they would be likely to use it. The most common reasons that they would be interested in this method are the fact that that it could be administered at home without a provider, and that it could be mailed or delivered to their home. And just as a little additional background, in California last spring, the state's Medicaid and Family Planning Program began covering sub-Q depot dispensed directly from pharmacies, as well as by mail order or home delivery. And Texas is also considering following in California's example on this. So we think this is a good example of a change that came about during the pandemic that has the potential, at least, for some lasting improvements in access for people who are interested in this particular method. Next. Okay, and now we're going to do another pause in our presentation, where we would love for all of you to share your experiences about the extent to which young people in your community are using telemedicine to access contraception. And we're interested in hearing more about the barriers as well as what is working well. And so we would invite you to get going in the chat box if you have anything to share on that. And related from our last chat break, Kimberly had shared that she's been moved by the community's creative response using social media to connect youth to contraception. And I'm really curious to hopefully hear more about what that's been like, the use of social media. Yeah, this is something that the clinics are noting, that there's a wide range of barriers to access. Yeah, this is a great hypothesis or observation from Laura about how a lot of the resources are national ones that may not take the local insurance or cost issues into account. That's something that I've definitely heard, that trying to put together resources for telemedicine is quite challenging because of all the variation in insurance cost and just system to system, and how to advise people on how to use that. Yeah, privacy is coming up in a lot of cases, and we heard that in our quotes earlier. I was inspired to hear about a community college that had set up a special area in their parking lot to try to increase access. If people didn't have a private space at home, that they could come and log into the Wi-Fi in the parking lot there in order to access telemedicine. Yeah, that's another thing, people feeling like, I don't want to take up resources during the pandemic. This has been great. Thank you all so much for your comments in the chat, and we'll turn it over to Cynthia and then have some time hopefully for Q&A. So I think we can go to the next slide.
Yeah, thanks so much for your participation and comments. It's good to see so many people who are thinking about young people and how to be able to reach them during these times. So I will summarize what we have seen in our data about the COVID-19 impacts. The pandemic has interrupted access to contraception for many young people. The strongest impacts among the economically disadvantaged and young people whose lives have been particularly disrupted by the pandemic. It's kind of it's snowball effect. Like there's as that one category was, there's too much going on. So people who already are facing these larger, broader challenges in their lives are the ones who face the most challenges, in particular with accessing birth control. We saw a very low use of telemedicine right now for contraception among young people. And most of them prefer the in-person visits that they are used to, and those who have been to a clinic who know about it. And they reported a range of barriers to telemedicine, but basically they're not familiar with it and don't know about it. There are some who have structural barriers who wouldn't be able to use it anyway, and we have to keep that in mind for services. Next. So recommendations, I think the most obvious one is to provide additional outreach and information for young people. Visual, simple information is always great in our increasingly visual world now, with images that appeal to people so that they can absorb information easily. We should also, our data showed us that we not just thinking about contraceptive care, but behavioral health services are so important. And someone obviously, as we saw in some of the quotes, suffering from depression and anxiety is not going to be able to have the wherewithal to go seek the care that they might need for their reproductive health needs or other broader health needs. We need to increase youth awareness of telemedicine and other service modes now covered by insurance. Insurance really broadened during the pandemic, and we're hoping that some of these new ways of reaching young people will remain after the pandemic, but we need to, and for those ways such as Depo Sub Q, that's now covered in California at least, just so people know that that option is new and is there. It's really important, as we saw the strong preference for in-person visits, to train all of our community clinics to offer safe in-person care now during COVID, and how to set up their visits, how to use their scarce staff resources. A lot of people in and out sick with a lot of caregiving responsibilities. We've seen from our provider data that Dr. Suzanne Goodman is going to present later today. Here is, this graphic is from our digital information that we give to the young people in our study that shows a map with all of these little marks are the clinics in their community where they can get care, and it gives that address and the hours, how to get there, whether they can do a walk-in appointment, whether they accept Medi-Cal or Family Pack, the methods that are available, and also at the bottom in the tips you'll see some of the things for today, whether they can have a phone visit or video visit, and reassuring them that they can stay in a car if they're lucky enough to be able to use a car to go to a clinic. A lot of people do have transportation visits now, but some can get access to a car and then wait in the car. So they are all worried about COVID risks. And one thing that was so clear in our data was that young people need support for critical basic needs, along with access to healthcare services. We can never forget these basic food, housing, and just to even be able to continue with their educations, we need to be thinking about their broader needs. Next. Oh, I think that was it. I just want to say a huge thank you. This study that we're doing we've had so many partners. Primarily, thank you to the students and the student voices for our community engagement. Also, the partnership with the Health Services Association, with the California Community Colleges, and in Texas are amazing partners at UT Austin. I also want to have a big thanks and shout out to our team at UCSF. It's taken a lot of us, both on the research and the training side, training the community clinics as part of this study to make it all happen. And and just a special thank you to our partnership with TCI. We have loved being able to work with you together in Oklahoma to combine shared lessons of what we know for people here. And thank you so much for having us. Next. So as I said at the beginning, we really welcome your feedback. These are just preliminary findings. If you have any other thoughts or see what's going on or are curious about something or really want us to know something or are upset we didn't talk about something, please feel free to bring it to our attention. There is my email right there to ask us questions if you want more information about our program. There is our website right here. And thank you so much for being with us this morning. And thanks to my colleague, Jen.